Hey there, and thanks for joining me today for this video. And really in this video what I want to talk to you about is stomach acid and reflux. It's such a common problem and there's so many different causes of it that most people just don't understand. And everything's put down to high acid, but there is other reasons other than high acid that may actually be contributing to reflux as well. Before we go down to all the things that could be causing it, let me just break down what reflux actually is. So when we look at your digestive system, so we've got our esophagus, which is the main pipe that joins from our throat to our stomach. When we look at it, we've got this here, then we've got our stomach, which then hooks into our intestinal tract on the way out. And this is really our processing plant. This is our absorption plant, if you want to call it that way. A little bit oversimplified, but an easy way to describe it. So one of the things that happens when we consume food is the food travels down the esophagus itself and eventually into the stomach proper through this area here. When it gets in there though, there are various different ways that food needs to be processed. So most people think that we need stomach acid to actually break down the food, and that's not actually correct. So different areas require different levels of processing and so do different foods. So for example, carbohydrate isn't really processed in the stomach at all. In fact, most of carbohydrate is processed as you chew it. The salivary amylase in the mouth starts breaking down the carbohydrate and the sugars in it, and the rest of it's done into the small intestine itself, especially with substances like fructose. Simple sugars like glucose go straight through and absorb through the stomach wall, but the bulk of it is done within the intestinal tract. The big thing that is actually processed in the stomach itself is protein. And that's where we break most of our proteins down into those small amino acid chains that we use to developing all those things we've already spoken about, like the methylation pathways that we spoke about a few weeks ago. You can jump back and view that if you want to go through that. So the main role that we have of stomach acid is actually to activate some peptides, or not peptides, wrong word, sorry, to activate some enzymes that are involved in breaking those things down. So as we consume protein, that acid level rises, and as the acid level comes up, it actually activates a substance called pepsinogen, and that is one of the things that we use to break down proteins and allow them to get absorbed through the intestinal tract. And this is why there's always these arguments about whether you should chew food and not chew food, and it's all about what you're consuming and when you're consuming it. So when we look at reflux, what we're really talking about is either the valve here isn't working very well, so therefore we're not getting closure, so this should actually close off this area, so once food has passed through, it doesn't come back. Or we're getting changes in the stomach function itself with the acid level, which is actually allowing for sort of like a bubbling up to the surface and allowing things to come through back to the throat. And some people will get this burning indigestion feeling through the chest itself. Other people won't experience anything and they'll just get this irritating cough after they eat, this type cough as they eat. And then some people won't feel that at all. Some people just get irritation at the back of their throat, especially if they've eaten late at night. So there's a whole lot of different patterns for reflux. It doesn't just mean one method and one symptom fits all. So what are we looking at? So the general theory that we take, and a lot of the understanding that most people have, is that the more acid you have, the more reflux you get. And that's not exactly correct. So what tends to happen is there's two other methods that we see that commonly create issues with reflux. So the first one is when this valve doesn't work very effectively. And I'm going to come back to that in a second. The second one isn't so much high acid, but when we have low stomach acid. So when we have a low stomach acid level, the problem that happens with low stomach acid is you can't metabolize that protein effectively. If you can't break the protein down, then as soon as it's finished and the time's up and it goes to send stuff out of the stomach into the intestine, we kind of get it spat back and says, no, you're not ready, this is not digested. And then with that, we get a whole lot of bile and other substances that end up back in the stomach that then irritate the valve and push the stuff up. So low stomach acid can actually have a negative impact and generate reflux. A lot of the proton pump inhibitors and other medications still have an effect in these people just because they're lowering the stomach acids even further, which means there's less chance for you to get reflux from that. But low stomach acids is one of the reasons we commonly see people getting issues with this type of problem. The other one we're going to come back to now is the valvular problem. So this is the valve at the top of the stomach where it meets your esophagus. This is what we're looking at here. So we're looking at this junction in this top area here. So when we have problems in this area, what tends to happen when we have these issues is this valve that you can see here, this muscular valve through here, is responsible for closing off the esophagus. And it doesn't sort of stay open as you eat. So what generally ends up happening is if you drink or if you eat, the food or the fluid goes down and it kind of rests on top of that valve for a little bit, and some people up to about maybe 6 to 10 seconds. And then once the body believes that you've consumed everything, it just quickly opens, lets it through and closes again. In some people though, that valve can get a little bit dysfunctional, a little bit lazy. So now what ends up happening is rather than having this nice area sealed off through here, and don't worry about this, is a little bit of an issue there, but rather than having this nice sealed off area, what ends up happening then is that the valve stays a little bit open, and then when it stays open, especially if you lay down, we get regurgitation of the stomach stuff back in towards the esophagus itself, and that then creates a level of irritation. So what can we do about this? So there's a few simple things that we need to understand. The first one is that stomach acid production and this valve production is under the control of a really important nerve in your nervous system called your vagus nerve. If you're not familiar with your vagus nerve, go back a few weeks. I did a whole series of videos over about 2 or 3 weeks where I spoke about what the vagus nerve is, how to determine if you've got a vagal problem, and things that you might be able to do about it. So you can check that out on my Facebook page or on my YouTube channel. So this is the first one we want to look at. The other big thing is stomach acid itself is really dependent upon zinc for the production, and also to an extent B6. Also neurotransmitter histamine also plays a role in stomach acid production as well. So it's a really complex issue that we have with stomach acid that really does affect things. And that mechanism really does need to be properly assessed to determine which of those is your issue, to identify what you might be able to do about it. But some key take-home things that we want to remember is anything that irritates this nerve. So if anything that irritates this valve, if you're actually creating irritation to the valve itself, you're going to inflame it, and that damage to that valve itself is then going to potentially predispose you to reflux. So we want to make sure that we keep that valve nice and healthy, and to do that we want as little backward pressure as possible coming onto that valve. So a couple of key things you can do is make sure that you're not eating or drinking quickly. So if you're eating or drinking quickly and you're throwing down 700, 800 mils at a time when you drink from a sports bottle, you're going to load up pressure from the top onto the valve, which is going to create problems for you and that valve. Likewise, from the other way, if you have a really large meal or even like a normal dinner, and you lay down, you're going to get backwards pressure coming up on that valve itself as well. So one of the things we talk about with those who are suffering reflux, or if you want to prevent yourself from suffering reflux, is don't eat within 2 hours of going to bed. Let your system have the chance of breaking that down. I know for some of you that's really hard because you get patient, you get nibbly at night, and there's plenty of reasons that can happen, from serotonin changes to all kinds of things, and we'll do some videos on that later on down the track where we can talk about how to stop that from happening for you. Anyway, hopefully that's given you some insight as to why high stomach acid may not necessarily be the cause of your reflux. If you have any questions at all with all that stuff, you want more information on it, or you're not too sure how to go about getting any help, just send me a message. I'm always happy to help or give you some advice in any way, shape or form I can. Remember guys, it's always about adding life and quality to all of your years. We'll look after yourself, and we'll speak to you in the next video. See you guys. Bye for now.